Alright, so this video is going to be a diabetic emergency. We're simulating a diabetic patient, and we'll try to get questions and answers as we go forward throughout the scenario. So we're going to assume that the scene is already safe. We've already got our BSI on. We know that there's only one patient, so that kind of stuff is already a given. We're going to move straight into the general impression and then go through the ABCs and things like that. So my general impression when I walk up is that this guy appears to be unresponsive. I can tell that something is going on. I'm not sure what, but I'm going to label him as sick. So next I'm going to assess his level of consciousness. So I'm going to talk to him. Hey man, are you okay? Can you hear me? In this case, he's not responding, so I know he's not alert. He's not responding to verbal. I'm going to try painful stimuli by doing a sternum rub, and I'm not getting any response there, so I know that he's unresponsive. So next I'm going to assess his airway. I'm going to look, listen, and feel to see if I see anything. I see chest rise and fall, and I can hear and feel air movements. He is breathing, so I know that he does have an airway. And at this time, there's no noises or anything like that coming from the airway. Next, I'm going to assess his breathing. I'm looking for rate and quality, so I want to see, is it deep, is it shallow, is it slow, is it fast? In this particular case, we're going to simulate that he's breathing slow and deep. I'm going to listen to lung sounds. I'm going to grab my stethoscope and listen to lung sounds real quick. Remember, you want to listen up high on each side. You want to listen in the middle on each side. And you want to listen down low on each side. So we're going to simulate that his lung sounds are clear and equal. Now I'm going to put him on a pulse ox and see what his pulse ox is, see what's going on. Alright, so now I'm ready to move on past breathing. Once I figure out what his pulse ox is, I may look at oxygen. I may or may not at this point in time. It's not really a big deal. We'll simulate that his pulse ox is 97, 98%. So there's no need at this time for oxygen, but it's something I may want to consider as we go throughout the call. Circulatory status, I want to check for a radial pulse, see if it's present. Also want to check for a central pulse. In this case, I've got both pulses. His pulses feel rapid and weak. I also want to assess his skin condition. It seems to be sweaty, he's pale, and it seems to be a little bit cool. I don't see any obvious killer bleeds or anything that's going on that would indicate that he's got any obvious life-threatening injuries right now. So I'm going to move on past my ABCs. Hey, does anybody know this guy by chance?
Yeah, I do.
Can I ask you some questions about like what's going on?
Sure.
While I'm interviewing him and asking questions, I want my partner to get vital signs. I want a blood pressure, I want a pulse, I want a respiratory status, and I want a blood sugar on this guy. When did you notice this guy? Like what happened?
I was over in the next cubicle, and he just started making weird noises, kind of groaning. Came over and checked on him, and he wouldn't respond to me when I called out his name.
Okay. Are you aware of any medical history of anything that this guy has?
I think he's diabetic, but I'm not really sure.
Okay. What would give you that impression that he's diabetic?
I've seen him do injections like into his stomach and stuff.
Oh,
I think
okay.
that's what diabetics do, right?
Yeah, usually they check their sugar or something like that, and then sometimes they inject insulin, in their arm or stomach or something like that. Okay. How long has this guy been like this?
I mean, it's maybe 5-10 minutes before we called you guys.
Okay. All right. My partner came back and he got my vitals for me. He said he got a blood pressure of 138/72, and he got a respiratory rate of 14, along with a pulse of 106 and a blood sugar of 46. So remember, for us, if we've got a blood sugar under 60, you treat regardless if they're symptomatic, and if it's between 60 and 80, you're treating if they are symptomatic. So this guy's unresponsive, so I can't give this guy oral glucose, but what I am going to consider doing is, one, I'm going to call for ALS. They can start an IV and give this guy some sugar intravenously, but also what I can do in the meantime is I can give this guy glucagon.
I'm going to go back to work if you're good with me.
Sure, sure.
Thanks.
All right. So I'm going to administer glucagon for this guy. Remember that intranasal glucagon, you've got to use 2 boxes, so it's going to be 1 milligram and 1 ml per nostril. So we're going to draw it up, we're going to mix it, draw it back up into the syringe, and administer it intranasally by the MAD device. Remember too that glucagon is either going to work or it's not going to work. Works as a reserve. So if they still have sugar stores in the reserve, you'll be able to work through that, and it'll bring up their sugar. It does take a while to work, but remember, if they burn through their sugar stores already, it's not going to do any good. So it's a one-time administration, one and done. It either works or it doesn't. So I'm going to administer the glucagon on this guy. I'm going to monitor him. I'm going to work on getting him loaded up, ready to go. I got the history as best as I could from his coworker. Not really much more information I can get as far as that goes. I really can't get a sample or a good OPQ or ST on this guy because he's unresponsive. So I'm going to work on getting him loaded up into the ambulance, and I'll work on my physical assessment and everything in the ambulance on the way to the hospital and on the way to intercept with an ALS unit. This guy is, even though he's unresponsive, his vital signs are stable. I'm going to monitor him about probably about every 10 minutes, every 5 to 10 minutes on this guy. Mostly what I'm going to be looking at is continuous checking of his blood sugar, see if the glucagon is working until I've intercepted with ALS and they're able to start a line and get this guy on some D50. So we'll work on transporting, continue to monitor his vitals, and get him to the hospital.